What are, doctor, the benefits? Well, thyroidectomy will improve symptoms due to hyperthyroidism or goiter. It offers the chance of a cure for thyroid cancer that has not a spread to lymph nodes or distant organs. What are, doctor, the risks, as well as the general risks associated with surgery and general anesthesia? The trauma of thyroid surgery can cause the parathyroid glands to stop working temporarily. If not treated, low calcium levels lead to muscle spasm or tetany. The glands usually recover within a few days. In 1 in 300 cases, they do not recover function, and oral vitamin D and calcium supplements are needed for life. Damage to the recurrent laryngeal nerves can cause temporary or permanent hoarseness. The superior laryngeal nerve above the thyroid gland is occasionally damaged, leading to voice fatigue and reduced vocal range. Are there, doctor, any alternatives? A single benign, non-cancerous nodule may simply be observed if the diagnosis is certain. An overactive thyroid gland may be treated medically with antithyroid drugs or radioactive iodine, that is, radioablation. Doctor, what can I do to prepare? If you have hyperthyroidism, you usually take antithyroid medication for 4 to 6 weeks before surgery. You may also take iodine for 10 days before surgery to reduce the size of the thyroid and the blood vessels supplying it. A beta blocker drug can reduce symptoms such as a rapid heartbeat or trembling. Hyperthyroidism is treated with thyroid hormone medication to obtain normal thyroid function. What if I don't have, doctor, the operation? Medical treatment can control an overactive thyroid gland, but surgery may be needed if this falls or is contraindicated. A goiter may continue to grow and restrict breathing if not removed. A thyroid cancer may continue to grow or spread if not removed. What happens, doctor, during the recovery period? Calcium levels are checked to ensure the parathyroid glands are working. This is carried out every 6 to 8 hours after a total thyroidectomy. After total thyroidectomy, thyroid hormone replacement therapy is needed with T4 or T4 plus T3, depending on your physician's preference. Postoperative scanning is done to look for residual thyroid tissue and radioactive iodine given to ablate any undetected thyroid. With partial thyroidectomy and lobectomy, thyroid function is certainly monitored regularly to see if thyroid hormone replacement should become necessary. Recovery from thyroid surgery usually takes 1 to 2 weeks, during which time your neck feels stiff and tender. You may have a temporary hoarse voice, cough, and pain on swallowing. Direct laryngoscopy, that is, visualization of the vocal cords, may be performed. You experience persistent hoarseness or shortness of breath. You can return to driving as soon as your head can turn without difficulty. Many people with benign thyroid conditions return to work after 2 to 3 weeks. Depending on how much thyroid tissue was removed, you may need to take thyroid hormone replacement tablets. In the case of thyroid cancer, enough thyroid hormone is given to suppress production of thyroid-stimulating hormone, that is TSH, in the pituitary gland. This helps to reduce the chance of any remaining thyroid cells regrowing. If thyroid cancer is diagnosed, a scan or radioiodine scintigraphy may be carried with 6 weeks within 6 weeks after surgery, to look for the spread of thyroid cancer cells, particularly in the lungs, by means of scintigraphy. You may be advised to take iodine supplements if you had a goiter linked with iodine deficiency, or if you were exposed to radioactive iodine as part of your workup or treatment.